Neuropathy, also known as peripheral neuropathy, is a medical condition that affects the peripheral nervous system, the vast communication network that transmits information between the brain, spinal cord, and the rest of the body. This condition arises when nerves are damaged or destroyed, leading to a disruption in the normal flow of signals. Neuropathy is not a single disease but rather a group of disorders resulting from various causes, including diabetes, infections, inherited disorders, injuries, and exposure to toxins. Types of neuropathy. There are several types of neuropathy, classified according to the affected nerves. Peripheral neuropathy. The most common type, affecting nerves in the hands, feet, arms, and legs. It often causes pain, tingling, and weakness in these areas. Autonomic neuropathy. This type affects the involuntary nerves that control organs and body functions such as blood pressure, heart rate, digestion, and bladder function. Proximal neuropathy. It affects nerves in the thighs, hips, or buttocks, causing pain and muscle weakness, particularly in the legs. Focal neuropathy. This type affects a specific nerve or group of nerves, leading to sudden weakness or pain in certain areas such as the face, chest, or leg. Causes and risk factors. Neuropathy can develop from a wide variety of causes, including diabetes mellitus, the leading cause of neuropathy, responsible for more than half of all cases. High blood sugar levels damage nerve fibers over time. Nutritional deficiencies, lack of vitamins such as B1, B6, B12, E, and niacin can contribute to nerve damage. Autoimmune diseases, conditions like lupus, rheumatoid arthritis, and Guillain-Barré syndrome can attack nerve tissues. Infections, viral and bacterial infections like shingles, Lyme disease, HIV/AIDS, and hepatitis C can lead to neuropathy. Toxins and alcohol abuse, chronic alcohol consumption and exposure to heavy metals or certain chemicals can injure nerves. Trauma or injury, physical injury from accidents, surgeries, or repetitive stress can damage peripheral nerves. Medications, some chemotherapy drugs and antibiotics are known to have neuropathic side effects. Inherited disorders, genetic conditions such as Charcot-Marie-Tooth disease cause progressive nerve damage. Symptoms of neuropathy. The symptoms of neuropathy depend on the type and severity of the affected nerves, but they typically include sensory symptoms, numbness, tingling, pins and needles sensation, burning pain, or extreme sensitivity to touch. Motor symptoms, muscle weakness, loss of coordination, and difficulty walking or performing daily tasks. Autonomic symptoms, irregular heartbeat, blood pressure fluctuations, digestive issues, excessive sweating, or bladder problems. These symptoms often start gradually, beginning in the extremities such as the feet or hands, and can worsen over time. Diagnosis. Diagnosing neuropathy involves a combination of medical history, physical examinations, and specialized tests. A physician may ask about symptoms, lifestyle factors, and underlying health conditions such as diabetes or alcohol use. Tests commonly used include nerve conduction studies, NCS measure how fast electrical signals move through the nerves. Electromyography, EMG evaluates electrical activity in muscles to detect nerve or muscle damage. Blood tests, identify underlying conditions like diabetes, vitamin deficiencies, or infections. Imaging tests, MRI or CT scans can help locate nerve compression or injury. Nerve biopsy, in rare cases, a small sample of nerve tissue is examined under a microscope to identify damage. Treatment and management. There is no single cure for neuropathy, but treatment focuses on managing symptoms and addressing the underlying cause. Common approaches include medication, pain relievers, over-the-counter drugs like ibuprofen or prescription painkillers can reduce discomfort. Antidepressants and anticonvulsants, drugs such as amitriptyline, duloxetine, or gabapentin help relieve nerve pain. Topical treatments, lidocaine or capsaicin creams can provide localized pain relief. Lifestyle and dietary changes. Maintaining a balanced diet rich in vitamins and nutrients supports nerve health. Avoiding alcohol and managing blood sugar levels are crucial, especially for diabetic patients. Physical therapy. Exercises help improve strength, balance, and coordination. For severe cases, braces or orthopedic shoes may assist with mobility. Alternative therapies. Acupuncture, massage therapy, and transcutaneous electrical nerve stimulation, TENS, may provide relief for some patients. Treatment of underlying conditions. If neuropathy is caused by diabetes, infection, or autoimmune disease, controlling these conditions can prevent further nerve damage. Complications and prognosis. If untreated, neuropathy can lead to serious complications such as foot ulcers, infections, muscle atrophy, and permanent nerve damage. In diabetic patients, loss of sensation in the feet may lead to unnoticed injuries that can become severe. Early diagnosis and treatment are vital to preventing irreversible damage. The prognosis depends on the cause and the extent of nerve injury. While some forms of neuropathy can be reversed, others can only be managed to prevent progression. With proper care, many individuals can live active, comfortable lives despite the condition. In summary, neuropathy is a complex neurological disorder that disrupts the body's communication system, often resulting in pain, weakness, and loss of sensation. Understanding its causes, symptoms, and treatment options is essential for effective management and prevention of further nerve damage.